and welcome to episode 18 of Empathic Action. I'm joined today by Charles-Antoine Barbeau-Meunier.
Well done.
It's great to see you. It's a former student of mine that suggested I connect with you because you do a lot of work, including workshops, where you talk about the importance of empathy within the healthcare system. So about a week ago, or maybe 10 days ago, we were connected on our first phone call to talk about that. And today we did a catch up and I discovered, guess what? You are COVID positive. And I thought
Absolutely.
maybe it would be worth having a conversation for viewers to kind of understand what it's like to be in the shoes of somebody who's living with COVID right now. So first of all, how are you feeling?
Well, it's I'm really not feeling so bad actually. So I'm probably in the lucky ones, but it's unpredictable. So there's days where I feel maybe more tired, less able, and other days I've woken up and felt great.
Right. And so what are some of the symptoms that you're living with right now?
So the way it started for me was actually nausea. Some people will have flares of nausea, and I thought that was a bit unusual. So I got tested, and indeed, right after that, I started having fever that was more frank, that was more clear, headaches, and myalgia, so muscle pain. So that was more of a clear portrait, and that didn't last too long. Now I'm really left with a sense of fatigue, and I can't focus very well. As I said earlier, my mind's a bit mushy, and that's kind of been my thing.
Now, I know for your graduate studies, you were really trying to understand how culture gets in the way of either fostering or hindering empathy, right? Or what can foster and hinder empathy within society. And you thought that one of the systems where empathy is most important is in the healthcare system. So you decided to become a medical doctor. And you're 1 year away from graduating with a medicine degree, and you'll be a doctor. And that's how you contracted it. Am I not mistaken?
Yeah, in a sense, it's true. Well, I'm doing rotations now as a medical extern, or it's my clerkship. So that's all been canceled. We're not doing our rotations now. So it's helping out at public health agency in my region. And it's just some medical staff had the disease with them. We had a big outbreak. Pretty much a third of our full team ended up contracting COVID. Yeah. So indeed.
Yeah, and that's at Shelbrooke, right, that you are?
Yes.
So, I'm very curious to know, my perception is that anybody who comes down with COVID now, tests positive, that there might be some stigma attached to it, to be like among the early numbers. Are you feeling any of that?
Well, I haven't seen anyone really speak out on their experience. Maybe because that's part of something people don't feel like talking about. I'm not too sure. But I think anyone inevitably, if they have COVID, I think you will feel a sense of stigma with that pathology, if only because people are so afraid of it everywhere. I mean, just the fact that it translates into these kind of irrational panic behaviors we've been observing in society is just all people are finding all kinds of ways to cope with that. So being a symbol of that, being yourself, positive with COVID, then I think people around you, you would expect that they'll try to keep away, or that they maybe they won't try to breathe too near around you, right? Even with the social distancing and all the hygiene measures, regardless how careful you are, it kind of becomes part of your identity now. Like you're that person, and you're also a COVID positive person.
Right. And I understand that not only are you concerned about your own personal well-being, but you live with some people, and you're obviously concerned about their well-being as well, right?
That's exactly the weird situation that you get put in, is that on one hand, I think as social animals, we want to be around people and we don't want to be excluded. So there's a kind of social pain to feel that you're going to be excluded, that you're going to be out of a group because of X condition, which in this case is COVID, right? So in one sense, there's that, and then at the same time that you yearn to be around people, you don't want to contaminate them. So you want to be really careful that you don't spread this around. So you have this kind of double pressure that it's being maybe against the feeling of isolation, but at the same time, this is the only way that you're not going to, because you feel incredibly, I mean, I would feel obviously guilty that if I transmitted that to people around me.
Right. So that's
Obviously.
the paradox. You,
And
as
there's
somebody,
also an unknown. We don't know the extent to which I would say we don't know the extent to which this is contagious either, which makes it very confusing. So today or yesterday, a Nature paper came out, right, that was showing how it's being spread by breathing. So now you're like, oh, so even with 2 meters apart, maybe even breathing is an issue. So it's also delicate to maneuver. So sorry, what was that you're saying?
oh, I was going to say, if you have any closing thoughts to the public that's watching, how people can become more empathic with people who have tested COVID, or
Hmm.
have tested positive with COVID.
So if we look at it from the empathy lens, so of course don't forget that people that have the disease will feel both that they're a threat to loved ones, so they'll have to deal with that kind of feeling of isolation. So don't shun them, don't exacerbate that feeling. Perhaps I think we should obviously be sensitive to that. On the other hand, it's reasonable to want to keep a distance. So right, it shouldn't be a social distance, right? It should be the physical distance, and making sure that people understand that we're not shunning them away. And the other part of empathy is also for ourselves. We really have to be empathetic that in that situation, it's totally okay also to either find this that we're more vulnerable, that it's more difficult, to totally accept also it's all right not to be so productive all the time. So obviously we need to have a kind of empathy and self-compassion in these times as well. So this is a big learning, I think, with the current situation.
So I would like to end by saying I hope you feel better very soon, and I hope that anybody who's watched the video will post a comment to wish you well and a full and speedy recovery, and that nobody in your circumstances comes down with it as well.
Well, thank you so much, Anita. And yeah,
Thanks.
don't worry too much. I'm part of the ones that are lucky the way they have it. So thanks a lot for taking time for interview.
Great perspective. Take care, Charles. Thanks for watching. See you tomorrow.